Okay, so what I want to do is show you this first exercise that is not only good for shoulder pain that you want to give to your clients, but you want to do this for shoulder health. So if you've got clients that are swimmers, that do overhead activity, that get them doing this as well, because not only does it help with pain, but it also helps with keeping your shoulders in good condition. So if you are a massage therapist, by all means, you should be doing this on a daily basis. So I want to show you, now these exercises were designed by an orthopedic surgeon, Dr. John Kirsch. And well, I'll go into what's actually happening in the shoulder joint and why this is so effective. And I'm going to show you in your notes, you've got I've got a heap of testimonials. There are people who have done this exercise from his book. He wrote a book about shoulder pain. Now, so I want to show you the testimonials, and you can use them for your marketing purposes or just for your own information. I've just got them there and you can have a look, but I've also showed you, I've highlighted what the specific shoulder pains. They were labral tears, slap tears, it was frozen shoulders that was helped, subacromial impingement, rotator cuff tears, bursitis. All of these problems were helped. In fact, Dr. John Kirsch did a study with 92 people. Lots of these people were scheduled for shoulder surgery, some were even shoulder replacement, and 90 out of the 92 were all pain-free, and even after years follow-up. The two that weren't, they just stopped the study for personal reasons, he quotes. But all of these people, like 60% of them were scheduled for shoulder surgery. None of them ever had to have surgery. So let me show you the testimonials, just to give you a bit of an idea, and then I'm going to show you what is actually happening, what we're doing to the shoulder joint that helps with these. Now remember, over 95% of rotator cuff tears are from subacromial impingement, and the most common of that is the supraspinatus. And I'll show you what we're doing by doing this exercise. All right, so I just want to give you a quick look at some of these testimonials. So this is from his KirschShoulder.com, and you can see just that, if you've got frozen shoulder, do not think, just buy it, magic. Help me avoid surgery, able to avoid surgery. So we've got that, right? Now, this is from the study I was telling you about. This is from his book. See, 70 of them had subacromial impingement. This is of the 92 that I was telling you about. Rotator cuff tears, 16 of them. 4 with frozen shoulder, and osteoarthritis of the glenohumeral joint with severe subacromial impingement. So you see here, 90 of these, it said here, 2 subjects quit the study for personal reasons. 90 were returned to comfortable activities of daily living and remained so after variable years of follow-up, 1 to 28 years of follow-up. So I put these that I've taken from Amazon and his book. These are his book reviews, right? But what I wanted to do is you can have a look through this if you want to. But now, let me remind you, all of these testimonials are from simply doing the exercise or the exercises, which I'll teach you. No treatment at all. So this has nothing to do with any treatments. It's only from doing this exercise. Okay, so you can see here I've written in red, just to summarize, what they had. Impingement issues, supraspinatus tendonitis, type 2 slap tears, and so on and so forth. So you can have a look through that, and if you want to take some of these out, some of these quotes from people, if you want for your clients, but you can have a look through that. All right, so that's in your resources there. Just say if you want it for your own knowledge to see what people are saying, but also for your clients as well. You could shorten this, but anyway, so that's in your notes. Right, so let me teach you what we're going to do and why we're going to do it. Okay, so this exercise is for anyone that can lift their arm above what he calls the horizon, so above horizontal. If you can't, then we have to use other methods that I'll show you before we can get into this one. But this is the one you want for your shoulder pain clients, and say clients that don't have shoulder pain but want shoulder health. If they're athletes, massage therapists, pretty much anyone, because we're all at the computer. So this is such a brilliant exercise, and it is simply hanging from a bar. Just simply hanging like this. And I'll go into the nuts and bolts of how to do it properly, but we'll start with partial hanging and then using your full body weight, and I'll go into that as well. But why hanging? Because if you're a massage therapist, like I am, we were told, now, to avoid overhead activity. I've been through this with a person who's got shoulder pain because it keeps grinding away, it keeps hurting them, right? So why hanging? We're always told if you hang, that's going to be bad because the rotator cuff will get pinched and will cause more tearing. Dr. John Kirsch, orthopedic surgeon, has done the CAT scans and said, no, this does not happen. It's a myth. What happens is that supraspinatus tendon gets further around when you're hanging. So if you can imagine, now the brilliant thing is not only it will help with your posture, it will help, or your client's posture, it will help with, as I say, your shoulders, but it also helps with, it decompresses the spine because you're hanging, and it's brilliant for your scapulohumeral rhythm, your shoulder blades. It does all of this, and it's not dangerous if the person is diagnosed with tears, as long as they can bring it up to horizontal their arm, okay? It's not for people that have severe osteoporosis. You have to get the other exercises, which I've given you, or unstable instabilities, frequent dislocations, because the shoulder's already too unstable. They're the people that won't do this. And he also says that they've got, precarious physical illness, as he said. So, really don't have, really unhealthy, I guess, very, very weak. And so just for that, you've got to go more conservative. But if anyone can do it, then absolutely you want that. And it will be painful for the vast majority of people at the start, and that is completely normal. So before I show you how to do the hanging, how to hang, but there are certain things that you need to be aware of and how much time, I want to show you what we're doing to the shoulder joint so you 100% understand what is going on. So I'll go back and I'll show you the anatomy of the shoulder, and then I'll show you exactly what's happening and why this is so powerful. All right, so let me show the anatomy just to remind you of what's going on. Right, so you know that subacromial impingement syndrome that we've got here, it's coming up, as I taught you, it's coming up. The bursa can get entrapped. The supraspinatus tendon can start getting tendinitis, start getting pinched, start getting torn, then start getting chronic and torn and tendinopathy, degeneration. So you know that because we've got this, whether it's due to poor posture, but the big thing I want you to remember is there's not enough space. Look at this image. That space there is not large enough. So what do they do in surgery? Well, this is your acromion. They'll grind off something, it's called acromioplasty, grind that off to create more space. We're doing that through hanging. How are we doing that? Well, we are actually remodeling. You can remodel bone. You look at like athletes, like tennis players, and they'll have 30% more bone in their dominant tennis arm. Right? So I think Rafael Nadal, he'll have a lot denser bone because bone, just like calluses on your hands, your skin gets where there are areas that of constant, say, wear and tear or stresses that will create, whether it's bone, whether it's skin, whether it's muscle, just like building muscle in weightlifting, right? Okay, so we know that. What we're doing here by the physical act of hanging, and it will be straight arms, so I'll talk to you about it, it's literally just with gravity, pulling down like this, this acromion starts to get, it pushes it back. It pushes it back. And, stay with me, we're going to show you the ligament. This is where, through all of this coracoacromial ligament here, we are going to stretch that ligament to create more space by hanging. It also stretches the capsule, such as adhesive capsulitis, frozen shoulder. So we're doing that as well. Now, the reason we talked about, massage school, it was thought that your supraspinatus tendon, if you hang, it would come and that would just tear it even more. That's why, but it turns out through Dr. John Kirsch's research, through CAT scans, is the supraspinatus, if that's where the tendon is there, it's not coming up there. When you hang, it comes under and passes through. So it's not getting, it's out of the way, basically. Okay, so by doing that, we stretch. Let's come back here. We stretch, we make this just like they do in surgery, but non-surgically. We are pushing that acromion, reshaping, even with hooked acromions. Over time, it will reshape this. And so what we're going to do is then create more space so it doesn't impinge through the simple act of hanging. It is by far the most powerful exercise, So I'm going to show you how to do it, all right? So, and how long, and so on and so forth. Remember, you need to tell your clients that this will create pain, which is normal, obviously not too much, but when you start off, as we start to reshape this shoulder joint and start stretching out the ligaments, stretching out this area to create more space, but that will be just pretty much a normal part of when they start off with this. So you need to let them know that. All right, so when you want to hang, the important thing is, for this to take place, is the hands must be forward. If they're like in this sort of chin up position, what's going to happen is the humerus is not in the right spot to get against that acromion. Okay, so hands forward. You can space them wherever you like. Now, it's really important. Now, you will develop more grip strength. So when you start off, it might be just for a few seconds as you start to build up more grip strength. So your hands are forward and you are literally just hanging. Now, we start off with partial hanging. So you want to see where you've got a bar, you can hang from a tree branch, make sure it's strong enough. If you've got a gym where you can hang from, or you get the client to go to a park where there are monkey bars, anywhere that they can hang. Or like me, I've got a setup here. It was a chin-up bar that I bought on Amazon for like $25 and got that fitted. But because I didn't have any bars that I could hang from here, so I've got that, which I'll show you. So you start with partial hanging, and for as long as you can do it. Now remember that as we're stretching this arch, there might be a certain amount of pain, which is fine as the person starts off with, okay? And that will lessen as they go along. So partial hanging, so if the person is hanging up over here and their feet are on the ground, they can just start to use just not all of their body weight. If the person's strong enough, then by all means, all of their body weight. It's only muscular effort in the hands, none of the shoulders, so it's literally free hanging, okay? You want gravity to do its work, all right? So you can start off with just a few seconds, then for as long as you can. Then what you want to do is you rest for a minute or so, and then you do it again. And he recommends doing 10 to 15 minutes in total, like over a 10 to 15 minute period of time. Okay, and then he talks about doing some weightlifting to strengthen, which I'll show you, strengthen the rotator cuff. But the first and the most important part is the hanging as we reshape that subacromial area through that arch and increase that size like I talked to you about. So we start off with partial hanging, and then, or as I say, if the person's strong enough to go to full hanging. So I'm going to show you that right now. Oh, now I've got some gloves to help with my grip strength. But so the person, you might want to recommend if they use gloves, that might be helpful. These are little weightlifting gloves that I bought, but they do help a bit. So yeah, let me show you how we do it. Okay, so you can see here that I've got them mounted up on the wall there. Now, you could also use like these sorts of handles that you get and hook them up onto something. I've got two handles of this thing here, so you could also do that and hang from those. But as I say, anywhere like a YMCA, your gymnasium, anywhere you've got a bar, a park that has the monkey bars. So you can see a closer look there, just to show you my setup there. Now, because it was up high, because the wall's up high, I've got a ladder. You do not want to be having the person jump up to it. So that's why you want to step up and then gently. So I'm going up to the bar here. I'll show you different angles. But you can see how I'm using partial body weight. So I'm just dropping my weight down there and I'm hanging using partial body weight. So give you another look here. You see here, hands forward. Doesn't matter where you're going to put them on the bar, but forward. And you see there, and I'm straight. And the only muscular energy is the grip. That's all there is, not the shoulders. And make sure you see how my head's in good alignment. Make sure you don't push your head forward, and teach your clients that. So you do that for as long as you can. You take a rest. So I'm having a nice rest here. When you're ready to go, whether it's 30 seconds or a minute, and here we go again. And that's what you instruct your clients. Now I'm doing full weight because I've been doing this for a long time. And you can see that swinging pendulum. That's absolutely fine. Just remind your clients that there might be some pain. It's quite normal, but you're not damaging the joint or the soft tissues or re-tearing anything, okay? So you see that, and I have another rest. So you can see I'm getting up on the steps. It's just because it was just a high wall. I didn't have anything else that I could use, and I wanted to have it in the air conditioning. So you can see that. So in a garage, a beam, a tree, anything that you can get the client to hang from. So partially hanging first until they get enough grip strength to be able to using full body weight. Okay, and that might take days, weeks, months, depending on the person. If they can go straight to full, then great, get them straight on a full. So you can see that legs are off the ground, hanging for as long as I can, and then I will have a break for a minute or so, and that's what you want to get to the clients, and just continue repeating that. Okay, so here's another look. Hands forward, holding on, and gripping there. And that's it. That's how simple and powerful this is.